I'm Giuseppe ROSANO. I'm consultant cardiologist and professor of cardiology at St. George's Hospital in London. And the topic of my talk today was the definition of heart failure and the way to diagnose heart failure, especially chronic heart failure. Regarding the definition, I presented the new algorithm and the new definition of the European Society of Cardiology Heart Failure Association that basically divides heart failure into three big groups. Heart failure with reduced ejection fraction, patients with an ejection fraction below 40%, patients with a preserved ejection fraction, those with an ejection fraction greater than 50%, and then the new classification of heart failure with mid-range ejection fraction that includes patients with an ejection fraction between 40 to 49%. This is an important group because probably will include different categories of patients. Is a new trajectory in some patients identifies a trajectory, and so we will have may identify patients that they may worsen left ventricular ejection fraction and become heart failure with reduced ejection fraction, but also will include patients that have other comorbidities and for temporarily develop mid-range ejection fraction, and then they will recover ejection fraction. So it is important to group patients in this specific subgroup in order to identify them, to follow their trajectory, and identify the comorbidities. The other point of my talk was how we make diagnosis, and this is according to the heart failure guidelines of the ESC HFA that basically use clinical judgment, so signs and symptoms, and accompanied by either the use of natriuretic peptides or directly by echocardiography. What is important for the natriuretic peptides is that they shouldn't be used to make diagnosis, but only to rule out the possibility of heart failure. Therefore, if a patient with a high probability of disease then has elevated natriuretic peptides, then needs to undergo an echocardiogram in order to confirm the diagnosis. So this was mainly how to set the stage for differentiating the different heart failure groups and how to make the initial diagnosis. Different story is the diagnosis in patients with acute heart failure, where what is important is to identify possible comorbidities that may induce and cause the acute decompensation, like mechanical failure, acute hypertension, coronary artery disease, and hypertensive crisis or arrhythmias. And once these are ruled out, then it is important to make a diagnosis as soon as possible. And once a patient is diagnosed with acute heart failure, it's important to assess whether it's wet or dry in terms of presence of congestion, and thereafter, according to the congestion, whether it's there is adequate peripheral perfusion. Therefore, if it's dry or if it's wet. So we will have patients with will be cold and dry and cold and wet, or patients will be warm and dry and warm and wet. And this is important because it will guide the therapy for the acute heart failure, and and identifying specifically the different subgroups will probably be helpful in improving the survival in the acute phase.